before the COVID-19 pandemic, more than 13 million Americans were living with low or no vision, and vision loss rates continue to soar 5 years later. But the question is why?
Charleston Clark spoke with the president and CEO of Vision Serve Alliance. She has a look at the work they're trying to do to determine what the numbers are nationally and the factors that play into high vision loss rates.
There's very little funding and services for that population. The federal government for the last 40 years has only appropriated about $30 to $35 million for that entire population. That's not a lot of money.
That's why Vision Serve Alliance, the Aging and Vision Loss National Coalition, and the Ohio State University College of Optometry set out to collect and analyze data on vision loss rates among different age groups and come up with a report so they're able to provide better services to those with low or no vision.
Who are these people? What are they like? What are their needs? What's their economic background, their education background? What is their health status?
This data is collected by analyzing two data sets. First, the largest phone survey in the world, the Behavioral Risk Factor Surveillance System.
And then the other set that we looked at is research or surveys done called the American Community Survey. And that is developed and administered by the CDC. And they look more at socioeconomic status, your education, employment, income, whereas BRFSS looks more at your quality of life, health-related quality of life kinds of things.
From these data sets, Lee Nazahi says they were able to learn more about those living with low or no vision.
As a percentage of the population, which is the prevalence rate, older adults, Americans, the prevalence rate is 7.3%. 7.3% of adults in America over the age of 65 have a vision impairment. It's 4.7%, the prevalence rate for working age adults, roughly.
The most profound finding was around income and how many people are living in poverty. Of the 4.5 million people with low vision, ages 65 and over, 37% were living on less than $20,000 a year. Meanwhile, 42% of the 8.7 million working age adults were living on less than $20,000 a year. Healthcare and transportation also play a role in those higher vision loss rates. I asked Nazahi what's next and if they will bring these reports to government officials.
2025 is the year that we are really going to make a big effort around broader public awareness, sharing this information, particularly with policymakers. We need to have integrated services and accessibility everywhere. So it's going to take more money, but I think it starts with awareness and then funding and then really setting forth on a big, ambitious plan to assure that there are more professional vision rehabilitation services.
I have more of the statistics they discovered through those data sets on our website, abcnews4.com. I also got to sit down with the president and CEO of the Association for the Blind and Visually Impaired South Carolina. I'll tell you where the highest vision loss rates are in the Palmetto State tomorrow on ABC News 4.